You may have heard of ADHD, but you don't actually know what that is. Is this some kind of disorder? Is this dangerous? So, what is ADHD? ADHD is a mental health condition that can cause unusual levels of hyperactivity and impulsive behaviors. Both adults and children can have ADHD. People with ADHD may have a hard time focusing on a single task or sitting still for a long period of time. It can also disrupt executive functioning ability, which helps people evaluate and execute more complex situations. There is a wide range of behaviors associated with ADHD. Some of the most common symptoms are having trouble focusing or concentrating on tasks, being forgetful, being easily distracted, talking excessively, interrupting others when they're carrying out a task, having trouble organizing daily tasks. 3 types of ADHD. Predominantly inattentive. People with this type of ADHD have extreme difficulty focusing, finishing tasks, and following instructions. Predominantly hyperactive impulsive. People with this type primarily have hyperactive impulsive behavior, like fidgeting, interrupting people, and not being able to wait their turn. Combined hyperactive impulsive and inattentive. People with this type of ADHD have a combined display of inattentive and hyperactive impulsive behaviors. This may include an inability to pay attention, a tendency toward impulsiveness, and above average levels of energy and activity. It's the most common type of ADHD. So, what about treatments for ADHD? Talk with your doctor. Effective treatment for ADHD often includes several approaches. These can include medication and 1 or more types of therapy, as well as behavioral measures that you can put into practice as a parent. Getting proper treatment can help you manage your ADHD symptoms and feel better. To learn more about what treatment might work best for you, talk with your doctor. Some of your questions might include: would medication, therapy, or both help? Would you recommend a stimulant or non-stimulant medication? What side effects for medication should I be aware of? Medications for ADHD. Medication is often an important part of treatment for someone with ADHD. However, it can be a difficult decision to make. To make the best decision, you and your doctor will work together to decide whether medication is a good option. If so, ask your doctor whether you need medication during school or work hours only, or on evenings and weekends as well. You and your doctor will also determine what type of medication might be best. The 2 main types of ADHD medications are stimulants and non-stimulants. Central nervous system stimulants. Central nervous system (CNS) stimulants are the most commonly prescribed class of ADHD drugs. These drugs work by increasing the amounts of brain chemicals called dopamine and norepinephrine. In people with ADHD, these types of stimulants produce a paradoxical calming effect. This results in a reduction in hyperactivity and an improvement in attention span in many people. The effect improves your concentration and helps you focus better. Common CNS stimulants used to treat ADHD include amphetamine-based stimulants, Adderall, Dexedrine, Dextrostat, dextromethamphetamine, Dazoxin, dexmethylphenidate, Focalin methylphenidate, Concerta, Daytrana, Metadate, Ritalin. Non-stimulant medications. Your doctor may consider non-stimulant medications when stimulants haven't worked for your ADHD, or they cause side effects that are hard to manage. Certain non-stimulant medications work by increasing levels of norepinephrine in your brain. Norepinephrine is thought to help with attention and memory. These non-stimulant treatments include atomoxetine, Strattera antidepressants like nortriptyline, Pamelor. Other non-stimulant medications can also help with ADHD. It's not fully known how these medications help with ADHD, but there's some evidence they help certain chemicals work better in the part of the brain involved with attention and memory. These other non-stimulants include guanfacine, intuninclonidine, Hep A. Potential side effects of stimulants and non-stimulants. Although medications for ADHD bear some side effects, your doctor can work with you to find the right dosage. The more common side effects of stimulants and non-stimulants are pretty similar, although they tend to be stronger for stimulants. These side effects can include headache, trouble sleeping, stomach upset, nervousness, irritability, weight loss. As with any kind of medication, ADHD medication has the potential for adverse side effects. These can vary, depending on the medication you're on and your individual reaction to the drug. Talk with your doctor if you experience any side effects. Sometimes you may have to try several medications to find the one that works best for you. Good luck.